More COVID cases at our schools tonight, leading to dozens of more students self-isolating. And it comes as 2 more people in our community die after testing positive for COVID-19. Plus, healthcare workers at this long-term care home are fed up. They say that they're being asked to make concessions on wages as they face greater demands during the pandemic. A live look outside at downtown Windsor tonight. Clear into the evening. We're going to dip just below 0. Colette Kennedy joins us tonight with the full forecast. I'm Chris Hensing. Thanks for joining us. As health officials in Windsor, Essex contemplate entering a lockdown during the second wave. 2 more people have died after testing positive for COVID-19. A man in his 90s and a woman in her 80s have died, according to the health unit. The man was at an unnamed long-term care home. That's 82 people in total that have died in Windsor, Essex. 41 more cases of COVID-19 announced today. The health unit says that as of this morning, there are 410 people that have an active case of the coronavirus. Now, both hospitals, Windsor Regional and Erie Shores, as well as Hotel de Grace Healthcare, have a no-visitor policy in place. Started today, there's exemptions for extreme cases. If a loved one is dying or needs palliative care, they're granted, but you want to check with the hospital first. And there's also more cases at schools, sending more kids home. A Catholic elementary school in Tecumseh and a high school in Lakeshore, both schools sending people home after a student at each tested positive. Today, the health unit declared our 3rd outbreak at a school in Windsor, Essex. The CBC's Katerina Georgieva joins us now live. Katerina, another outbreak at a school in Windsor.
Yes, Chris, this was declared within a cohort of Corpus Christi Middle School students. This group of 22, they were first sent home a week ago when 1 case was confirmed. But since then, that number has gone up to 7, and therefore an outbreak has been declared. Now, I just want to be clear that while these are all Corpus Christi students, they were actually all attending the Central Park Athletics campus that the board has. They have some of their satellite schools there. It's part of their sports academy program. So none of these students were ever actually physically at the main campus of Corpus Christi. And again, this outbreak is just contained to this 1 cohort. No other students or staff are affected. They're considered low risk. Here's what the school board is letting parents know today.
In this case, obviously, because of the fact that all of the cases that were in the outbreak that was just declared by the health unit today are students who were already dismissed. What we're telling parents is that if they're not part of that cohort, that it's okay for them to continue sending their kids to school to attend those classes at Central Park Athletics.
And the Catholic board is also working with the health unit on the outbreak at Langlois. That entire school had to be shut down so that everybody could self-isolate. But that quarantine period is up in a few days, so we should be hearing from the board soon on what reopening might look like.
Now, Katerina, you mentioned the health unit, all of this happening as we see outbreaks, cases rise. And last night we heard that the public health system could be on the verge of collapsing, but help is on the way.
Well, the health minister says that the province is doing what it can to support Windsor, Essex. They're sending in 24 contact tracers, provincial contact tracers, to help with contact tracing. And they're also working with the health unit to try and recruit 10 case managers as well. But even still, during question period today, local MPPs were really stressing that more help is needed, and they were pressing the health minister on this. Have a listen.
Local health staff are working 12 to 15-hour days, 7 days a week. They're doing the best they can with the limited resources they have. We need help, and we need it now.
Our health unit has been underfunded for years. Before COVID, we were one of the lowest funded public health systems in the entire province. Will the Premier immediately give our health unit the resources they need to stay on top of screening, testing and tracing, along with the other public health services that they provide in our community to keep us all safe?
We have also provided additional resources for tracing and contact management. If more resources are needed for that, we will certainly provide them. But we've also provided an additional 30 beds to the hospitals and alternate health facilities, because we know Windsor Essex is going through a very difficult time.
And the health unit did speak about the help that it has been receiving. Earlier today, it says it'll take whatever supports it can get, particularly when it comes to contact tracing, because right now it's taking up to a few days to actually reach out to people who might be dealing with COVID because of what the caseload is. Internally, they said that they're also doing some shifting of staff, moving some more people onto COVID work as well. So they're hoping that between the ministry support, help from the ministry, as well as their internal changes, they're hoping that they'll be able to get a handle of this soon, and they're hoping to see the impact of all this, hopefully within the next week and a half. Chris.
Thanks, Katerina. CBC's Katerina Georgieva live tonight. Every student getting on a school bus in Windsor, Essex will now be required to wear a face mask. Up until now, kids from JK to grade 3 were exempt. The board of the company that runs the buses, that's West's, approved the decision. It comes after both English school boards passed their own motions. The new rule comes into effect immediately, but won't be strictly enforced until January 1st. Now, right around this time is when people start making plans to spend the holidays with parents, kids, or other extended family. Some people might be thinking of getting a COVID test as a way to get around pandemic restrictions, but the health unit is warning against that idea. Dr. Ahmed explained why at today's daily health unit briefing.
I don't want people to think and use the test as a tool to find ways to still do what they do. Because if that's the approach, I think that's the wrong approach, because we know from the incubation period perspective. So even let's say if someone had a high risk exposure today, and even 3-4 days down the road, they go and get themselves tested, and if it's negative, they feel fine, they could still be infected, that their symptoms can start to show up 10, 11, even up to 14 days after their last exposure.
Now, for the 6th straight day, more than 1,700 people tested positive for COVID-19 in Ontario. 35 more people died. And there are now more than 100 long-term care homes that are dealing with an outbreak. The NDP wants the Ford government to do more to protect residents in those homes by moving some of them into field hospitals. Lorenda Redikoff explains.
Why have you not come up with a plan for emergency measures and treat this like an emergency, treat seniors like the people they are and not casualties of the COVID war?
Demands from the opposition today for changes in long-term care. The minister took offense.
Those comments are very disrespectful to the people that are working round the clock.
In some long-term care homes, some residents still sleep in rooms with 3 or 4 beds. They're known as wards. A directive added during COVID forbids them for any new admissions. Today, the NDP offered this suggestion.
Field hospitals or rent hotel rooms or do something when you know that people in wards are at greater risk.
A long-term care home in Windsor first started using a field hospital in the first wave. Today, the Premier said it's an idea they're considering elsewhere.
Yes, we are. We have a great field hospital in Windsor right now. They're doing a great job, but definitely we're looking at it.
We're looking at the best place to move residents of long-term care homes or people that require places to live if they have to move out of their homes, the long-term care homes that they're in. But it has to be appropriate, it has to be safe, it has to be culturally appropriate for them as well.
One doctor who works with seniors has been advocating for this.
I think it makes good sense. It's clearly one of the more radical and logistically challenging things to execute.
He says it would be less challenging on a home's property, giving access to kitchen staff, for example.
We know that the homes are still crowded to dangerous levels. We know that those outbreaks are larger and deadlier.
This home in Mississauga is one of several in the province now being managed by a hospital. In total, 27 residents have died here. Overall, in Ontario, long-term care residents make up more than 60% of all COVID-19 deaths. Lorenda Redikoff, CBC News, Toronto.
Now, you heard Lorenda mention the field hospital here in Windsor. Just a reminder of how it was used at the start of the pandemic. More than 50 people were brought to the field hospital at the St. Clair College Sportsplex, taken there from Heron Terrace, dealing with a major outbreak in the first wave. 16 people died there after testing positive for COVID-19. It ran for about 2 months. It has the capacity to run 100 beds, and is ready to go whenever health officials think it's needed locally. Healthcare workers at a long-term care home in Tecumseh are furious with the owner. They say that she's asking for concessions on wages and benefits at the bargaining table, and it's coming as they deal with greater demands and high stress from the pandemic. CBC's Dale Molnar has more.
Get her to the table and make sure she negotiates a fair collective agreement.
That's what Unifor Local 2458 wants the province to do. Local President Tulio De Ponte says the owner of Briette Manor has delivered 6.5 pages of concession demands. De Ponte says it's unacceptable to ask the 77 frontline workers to take concessions during the pandemic.
But for them to just come to the table with those demands, it's insulting, it's a shame, because these people are heroes. They're risking their lives to take care of residents.
The union is looking at wage increases and benefits for part-time workers. De Ponte says the company wants to hold the union to the terms of an arbitrated settlement reached last year, but that was before the pandemic.
How can this government reward profit-taking corporations when at the bargaining table, those companies treat healthcare heroes as zeros?
MPP Percy Hadfield is putting pressure on the government to act.
Especially after the provincial government just gave them millions and millions of dollars in order to expand, in order to renovate their facility. And now this company is trying to take away everything at the bargaining table for the frontline heroes.
Our government is committed to putting our residents at the center, and that means focusing on the staff as well. What we've done is provide them with pandemic pay.
But De Ponte says these workers have not received pandemic pay. He says the facility is understaffed and can't meet the government's commitment of 4 hours of personal care per resident.
We're going to get more sick people, and there's not going to be enough people in these facilities to take care of these residents. This is all over the board here. It's not just a Briette Manor. This is industry-wide.
CBC has reached out to the owner of the nursing home, but we haven't heard back. No new talks are scheduled. The union expects this will likely go to a conciliator in 2 weeks, and if no agreement is reached by then, it will likely go to arbitration. Dale Molnar, CBC News, Tecumseh.
It's December. Usually by this time, most of us who are interested in getting a flu shot would have gotten it already, but not this year. There's been so much demand that some pharmacies just can't keep up.
I've never seen so much interest in it. And overall, it just hasn't abated. We've probably got a wait list of several hundred people. Certain amounts were allocated to pharmacy, other doses were allocated to the health units. So if a health unit is running a flu shot clinic, they'll still have some. And then the problem is it's two different, basically, bank accounts. So our bank account's empty, they still may have some.
Brady calls demand for the flu vaccine this year astronomical. In fact, he says that he gave as many flu shots just at the beginning of last month than he did all of last year. It resulted in some pharmacies having to redirect patients to the local health unit.
We're allotted 127,000 doses every year, so we've distributed 114,000. So we still have vaccine doses in-house. Even though we don't have any high-dose vaccine available, we do have regular doses of vaccine that can be given to the general public, including people over 65.
Now, those 114,000 doses of the flu vaccine that the health unit says it has distributed goes to places like long-term care homes and hospitals. Meanwhile, pharmacies have to get theirs directly from the provincial government. Britain's medical regulator has approved a COVID-19 vaccine and a nationwide vaccination program that will start next week. The news is being greeted with enthusiasm and some concern. Cindy Palm explains.
It is almost a year since humanity has been tormented by COVID.
It's the first clear sign that life will begin to return to normal. 800,000 doses of the vaccine will soon be arriving from Belgium. Pfizer and the German drug company BioNTech say it's 95% effective.
They've used the virus itself to perform a kind of biological jiu-jitsu to turn the virus on itself in the form of a vaccine.
The elderly and medical workers will be the first to get the shot starting next week. The European Union is criticizing the lightning speed of approval. However, the British drug regulator insists the vaccine is safe.
I emphasize again that this recommendation has only been given by the MHRA following the most rigorous scientific assessment of every piece of data.
The UK has ordered 40 million doses, though the bulk of it won't be rolled out until next year, and it requires taking 2 shots 3 weeks apart. As a result, Prime Minister Johnson cautions social distancing will have to be in place for a while.
It's all the more vital that as we celebrate this scientific achievement, we're not carried away with over-optimism or fall into the naive belief that the struggle is over. It's not.
When the vaccines do arrive, the government is concerned people won't get the jab, as vaccinations will not be mandatory.
I gave you the train analogy many weeks ago now. The train has now slowed down safely. It has now stopped in the station. What we need now is for people to get on that train and travel safely to their destinations.
It's the first of many vaccines waiting for approval. This one does come with challenges because it needs to be stored at -70 degrees Celsius, whereas the Oxford University AstraZeneca vaccine, yet to be given the green light, does not require cold storage and is easier to ship. This announcement coincides with the end of the national lockdown here in England, and approval of this vaccine could be seen as a major victory for a government that has been criticized over its handling of this pandemic, in particular over its perceived delayed response in imposing restrictions. Cindy Palm for CBC News, London.
The coronavirus vaccine developed by Pfizer has been authorized for emergency use in the UK. Healthcare workers could start getting their vaccinations as early as next week. Health Canada is also looking at the Pfizer data, and the process here is independent of other reviews around the world. There's a good reason for that, according to Dr. Samir Gupta.
It's important for each jurisdiction to have their own process. You know, there are examples of drugs that, for example, the FDA has approved in the past, we haven't, and vice versa. And we also know that sometimes there is political interference. We've heard about this recently at the FDA. So I think Canadians want to know that we have our own independent scientific review process.
Now, Dr. Gupta expects the Health Canada approval process for the Pfizer vaccine to be completed by the end of this month. We take another look outside today. All that snow started to melt and then turn into some of the icy stuff on the roads today for some of us, but it looks like there's no flakes in our forecast this evening. But before we go to break, we want to show you a little more of the Bright Lights Festival here. This is the COVID-19 version, of course, spread out across Windsor to keep it pandemic safe, trying to keep those crowds down, but the spirit's up. Runs until January 10th. A very special visitor found a perch high above the Detroit River. Take a look at this. It was posted by the Ambassador Bridge Company on their Facebook page. A beautiful shot, a bird's eye view, if you will, of a falcon looking straight into the camera. I don't know if it's a pose. I don't know what's going on. All I know is I'm a little bit nervous because anytime you get those types of heights involved, it just makes you a little bit, you know, you just wonder, you question what it's like up there. We're going to get Colette Kennedy to join us in here now. That look was very picturesque of Windsor and all that, but could you imagine what it would be like to be up there?
Oh, it just doesn't even look real. I mean, I know, but it seems so unreal. But yeah, he or she is really given the evil eye. You know, Christmas is coming. You better be good, kind of thing. It's incredible.
Drones type of thing. Yeah.
Yes,
got an eye
exactly,
on you.
exactly. Let's see what we have an eye on in terms of. Listen, that's a segue. I don't know. I'm trying. In terms of our temperatures and what we're looking at, 3 degrees right now. That's our current reading in Windsor, and we've got 2 degrees for Chatham, Kent. A little cooler over towards London, where there's even more snow on the ground. And speaking of that, all right, we're not seeing anything in terms of any active weather right now on our radar and satellite imagery. And this is what's happening. This is on a loop here, so taking us up towards the current time. You can see those clouds exiting well off to the east with what's left of that system. But now I want to show you a different image, all right? This is from earlier today, where I've just kind of put on here instead the visible satellite. All right, well, there's those clouds. Those are moving. Why aren't these clouds moving? Of course, why they're not? Because these aren't the clouds. It's the visible imagery picking up the snowfall on the ground. There's a little bit of cloud cover you can see scooting through there. But otherwise, this is some of the snowpack on the ground, where up around the Bruce Peninsula, 44 centimeters for Wyerton, but there were reports of even close to 50 in a few spots back towards Windsor. By the time we were done, and again, it was a little more towards the east, but it was up to 10 to 12 centimeters. So back to what's going on, what we can anticipate overnight tonight. We are looking at the clearer conditions, but then watch that cloud cover try to sink in here as we go through the day on Thursday. So I believe we are going to start off with some sunshine, and then that cloud cover is going to back here into southwestern Ontario, and so then we'll be seeing things becoming much more overcast. The winds across the lake still going to be giving a little bit of light lake effect, but that's far away from us. A few little flurries off towards what's going on towards the Golden Horseshoe, but I will mention we have a chance as we go into Friday of getting into a few wet flurries in there too, as that cloud cover hangs in. So that's more Friday than for tomorrow. Tonight, your temperatures, -2 for the low, but just keep in mind, even though, again, the winds aren't as strong through the overnight with this particular trend, but it's still going to feel like -7 for tomorrow morning, so that's your wind chill. And tomorrow afternoon, the timing on the cloud may have an impact on this, but I'd put us at 4 degrees for the afternoon, with our winds coming from the southwest, 30. By the afternoon, they'll be backing off to about 20. So we're close to our seasonal averages there for the daytime high, and we're going to be there again into Friday with a few wet flurries there. And then Saturday, it's a shot of some colder air that kind of comes in. So look at our daytime highs. It's not the overnight lows. They're not that bad, but we are definitely below seasonal for those daytime highs for the weekend. But no active weather, at least, Chris.
No active, no. Just that little word, wind chill. It's back in the action again here, eh?
Yes, it certainly is. 'Tis the season.
No, absolutely. Thanks, Ms. Colette.
You're welcome.
Coming up next, we'll have an update on the federal government's plans to try and hit its own imposed deadline to lift boil water advisories in First Nation communities. The federal government has admitted that it will not meet its own deadline for lifting all boil water advisories in First Nations communities. Ottawa is pointing to the pandemic and other reasons for the delays while promising more money to help. Tom Perry reports.
And today, we're making ourselves accountable. We're making future governments accountable.
From federal Liberals today, an acknowledgement they've fallen short on a signature pledge.
And while there have been many reasons for the delay, I want to state as clearly as possible that ultimately I bear the responsibility for this, and I have the responsibility and the duty to get this done.
The Liberals promised in the 2015 election to lift long-term boil water advisories in all First Nations communities.
Because it's not right in a country like Canada that this has gone on for far too long.
The goal to do it by March of next year.
Because of COVID, many projects lost a full construction season. And this shouldn't be a surprise to anyone.
The government now says the pandemic and other factors have put that goal out of reach.
The Liberal government has just acknowledged that they will break a commitment to the Indigenous people for clean drinking water.
We remain aggressively committed to lifting all long-term advisories and ensuring First Nations can have clean water now and into the future.
Ottawa is promising an extra $1.5 billion to continue work. That's on top of more than $2 billion already committed.
I welcome those announcements today, but as I said, these are resources that we've been waiting for a long time.
The Liberals say they have lifted nearly 100 long-term drinking water advisories. Roughly 60 still remain. The government hopes to have that down to perhaps a dozen by spring, but the work isn't over. Tom Perry, CBC News, Ottawa.
And that's it for us here at CBC Windsor News. Don't forget, you can go into our website anytime, cbc.ca/Windsor, for more updates on these stories. We're on social media too. You can check us out on Facebook and Twitter. We stream the show live on those platforms. We got an Instagram account as well. That's it for us. Have a good night.